Hi, everyone. Thanks for joining us today. We'll give it a second for everyone to get loaded in.
Can you see me?
Don't see you yet.
Okay, you don't see me.
There you are. Hi, Mustafa. And hi, everyone. Thanks for joining us today. I think we'll get started. Welcome to this Global Adaptation Month webinar hosted by EcoAdapt National Adaptation Forum team. Global Adaptation Month is an initiative aimed at advancing action, awareness, and accountability for the field of climate adaptation. We encourage you to visit www.globaladaptationmonth.org to learn more and share your commitment to climate adaptation action today. I'm Molly Johnson, coordinator of Global Adaptation Month, and I'll be your organizer for today's webinar, Climate Justice and Compounding Crises. Before we get started, just want to go over some housekeeping rules to make sure we all have a successful webinar. So please place your telephone, cell phone, or computer on mute. I do hear some background right now, so that'd be really helpful. It reduces background and any other feedback we could get. And if you are using microphone voice over IP option, please ensure you place your computer on mute, even if you're listed as muted when you log in. We will have time after the presentation for question and answer. So throughout the webinar, you can submit any questions to the presenters via the question function. And we'll do our best to get to all of them. And please also use the question function to report any technical issues or problems you might be encountering. We will help you address any problems to ensure you have a favorable webinar experience. Finally, we'll be recording and posting this webinar on the Climate Adaptation Knowledge Exchange website for future viewing. The webinar will be available online next week and can be found at www.cakex.org. I'm pleased to introduce today's moderator and panel. Dr. Adrienne Hollis is the Senior Climate Justice and Health Scientist at Union of Concerned Scientists. In that role, she develops and implements projects to document health impacts of climate change on communities of color and other traditionally disenfranchised groups. Dr. Hollis is also an adjunct faculty member as a professional lecturer in environmental and occupational health at the George Washington University School of Public Health and has more than 20 years of experience in the environmental arena. Dr. Sacoby Wilson is an associate professor with the Maryland Institute for Applied Environmental Health and Department of Epidemiology and Biostatistics, School of Public Health, University of Maryland. Dr. Wilson has over 15 years of experience as an environmental health scientist, working in partnership with community-based organizations to study and address environmental justice and health issues and translate research into action. Dr. Wilson also is the Director of Community Engagement, Environmental Justice and Health Initiative, which provides technical assistance to communities fighting against environmental injustice and environmental health disparities. Mustafa Santiago Ali is a renowned thought leader, international speaker, policymaker, community liaison, trainer, author, political strategist, TV commentator, and facilitator. Dr. Mustafa Ali wears many hats. He is the Vice President of Environmental Justice, Climate, and Community Revitalization for the National Wildlife Federation, and is also the founder and CEO of the Revitalization Strategies. Before joining the NWF, Mustafa was the Senior Vice President for the Hip Hop Caucus, a national nonprofit and nonpartisan organization that connects the hip hop community to the civic process to build power and create positive change. And last but certainly not least, Hilton Kelley is one of the top environmental justice activists in North America. After serving in the United States Navy with honorable discharge and an acting career where he was inducted into the Screen Actors Guild, Hilton was inspired after a visit to his hometown to take action to rebuild and revitalize his community of Port Arthur, Texas. He founded the Community in Power and Development Association, Incorporated, in 2000 and began to challenge the environmental violations of the plants that loom over the community he calls home. In 2011, Hilton made history as the first African American man to win the Goldman Environmental Prize in recognition for his accomplishments in reducing the amount of toxins emitted by refineries in Port Arthur, Texas. So thank you all for being here today. It's a real honor to have you. And with that said, Adrienne, I'll pass it off to you to facilitate today's discussion.
Thank you. Thank you, Molly. I'm very excited to be here today, and I'm very excited to have such an esteemed panel. This is fantastic. And I think that this is an important conversation, and I'm so happy that we're having it, and I'm so happy that we have this great group of people. Before we get started with our specific questions, I'd like to have us sort of lay the foundation for our listeners, and I'd like to start with Hilton, if you don't mind. So if you could just briefly describe the work that you're doing in your community, and from a personal perspective, the effect that climate change has had on the community that's already overburdened, and then maybe a little bit about COVID-19.
Okay, thank you. Hello, everyone. As stated, my name is Hilton Kelley. I'm the founder and director of the Community in Power and Development Association, located in Port Arthur, Texas, on the Gulf Coast. The work that we're doing here in the city of Port Arthur and in other places around the country mainly deals with fossil fuels. We are fighting to push big polluters like refineries, chemical plants, chemical incineration facilities, to reduce the amount of pollution that they dump into the air by upgrading much of the antiquated equipment that they use at these facilities. And also, we're pushing them to reduce the amount of material that they process in communities like Port Arthur, Texas, Richmond, California, South Philly, you name it. And so many times what happened in our community, due to the sheer volume of the amount of petroleum material that's processed, well, it's a given that periodically there's going to be an emission event. And whenever you have an emission event, what happens is a lot of the material that they're processing, such as petroleum, crude, raw crude, much of that material has to be sent to the flare and burned if they can't process it as it's flowing through the pipe due to some malfunction. And when they burn this material, when you burn petroleum, all of this black soot and smoke comes off the tip of the flares, and then it sort of spews into the community, and then you have this particulate matter that rains down on your car, it rains down on the plants, it rains down on human beings that are outside at that particular time. And not to mention the particulate matter is so fine to where you breathe it in, you ingest it. Now, these kind of procedures go on day in and day out. If you look at the emissions being emitted into the air, the night sky, that photo is a photo of Oxbow calcining. Now, Oxbow calcining is a facility that's owned by the Koch brothers, John Koch to be specific. These guys take the leftover material from the raw petroleum, which is almost like a tar-based material, and they further burn it to make asphalt and other kinds of useful material out of it from their perspective. But as they're burning it and as they're processing it, more hydrocarbons are being released into the environment. These guys don't even have scrubbers. They have no way of capturing the heavy metals that are emitted, the sulfur that's emitted. Oxbow calcining put out 98% of all the sulfur dioxide in our county. Now, in our county, we have at least 7 refineries and about 4 chemical plants. And all of those put together they cannot put out more, they do not put out more SO2 than Oxbow calcining. Oxbow put out 98%, all the refineries and chemical plants together in our area put out 2% of the SO2. So these guys are basically somehow grandfathered in illegally, and they just dump at will. And because of these hydrocarbons being dumped into our environment, we have a disproportionate number of young people and elderly folks that are suffering from respiratory problems like bronchitis, acute asthma, you name it, we have it. We have skin disorders. We have a disproportionate number of people in the city of Port Arthur that are suffering with cancer, and many of them have met their demise due to illnesses with cancer, and their bodies just couldn't fight anymore. Port Arthur, Texas, as I stated earlier, is home to a large number of refineries, but the largest oil refinery here is is the Motiva oil refinery. Motiva, they put out 633,000 barrels of oil per day. And that's not counting the other industries in the area. And due to the sheer volume, there are accidents that take place, and almost on a monthly basis, there's going to be some type of impact. Now, when you're talking about climate change, well, it's a no-brainer. When you look at the photos that was up on the screen and the ones that are there now, we are a huge contributor to greenhouse gases. Port Arthur, Texas is one of the most industrialized cities in the state of Texas. And we put out our fair share of greenhouse gases. Much of the hydrocarbons that go up into the air, it travels. It just don't stay in one community. And the gases that continue to rise and contribute to the good ozone is turning into bad ozone. We're contributing to acid rain. And we are disproportionately bombarded with petroleum material falling from our skies when it comes to sulfur dioxide, when it comes to sulfuric acid, when it comes to 1,3-butadiene and the benzene material that's also released into our environment. So we are known as Cancer Alley in many publications that have been put out. And I remember that back in the 60s, it was a beach that everyone frequents here in Port Arthur, Texas. And back around 1965, 68, you know, we would go to the beach and we recognized that the surf was back maybe about 50 yards away from the road. Well, fast forward from 1968 or 65 up until 2020, the road is no longer there and the surf sits over the road. So it's a no-brainer for us. Sea level rise is real. Climate change is real. Winters in Port Arthur, Texas, and in the southern region aren't like they used to be. I mean, it was a time to where we would have a hard freeze periodically, but now it's rare that our temperatures drop below 40 degrees. So we have some real issues. And the way this kind of ties into COVID-19, well, many of the publications have put out that African-American people are more susceptible to COVID-19 because of their pre-existing conditions. Well, those pre-existing conditions consist of hypertension, liver and kidney disease, respiratory issues like asthma and bronchitis. Many of the pre-existing conditions that we suffer with here in Port Arthur, Texas, and the Houston Ship Channel, the Deer Park area, and in West Oakland, Richmond, California, South Philly, Buffalo, New York, it's because of the industries that bombard our communities day in and day out with chemicals that attack the respiratory system, that contributes harmful chemicals and contribute to hypertension issues and liver and kidney disease, because much of this material that we breathe in, it also invades the blood. And once it gets into your blood, it travels throughout your bloodstream, impacting various parts of the body. And there's still stuff that we don't know, or parts of the body that we don't know that are being impacted, because we have yet to do a cumulative impact study on all the various toxins that's in our air. We know what sulfur dioxide does. We know what benzene does, but we don't know what all these chemicals mixed together in our air. How does that impact our bodies and our respiratory system? But one thing is certain: 1 out of every 5 households here have a child or someone behind the door that has to use a nebulizer when they go to school or take breathing treatments before they go to bed.
Wow. Thank you. Thank you for that, Hilton, for setting the stage for us. I appreciate that. I know we all do. And Sacoby, can you, or Dr. Wilson, can you briefly describe, Hilton has given us a lot of information around the health effects that that are present in his community. Can you briefly describe in general some of the environmental health effects from climate change and how they are exacerbated by COVID-19? But given the pre-existing conditions that Hilton talked about, Sacoby, can you start from there? That you already have this foundational challenge.
Yeah, can you hear me pretty well?
Yes.
Yeah, so as Hilton mentioned, you have folks in this community that have these underlying, health conditions, comorbid conditions. And I think it's important to note that what Hilton was saying is many communities are already impacted by double, triple, quadruple disparities, right? So they're overburdened by hazards, they're overexposed to pollution, they're dealing with psychosocial stress, and don't have good access to infrastructure, right? So whether it be parks, green space, healthcare infrastructure. So if you have populations that have these underlying conditions, that increases their susceptibility. So as Hilton already mentioned, because of some conditions like asthma, you already have asthma in an area that's highly polluted. Recent Harvard studies show that individuals who are long-term exposure to PM2.5, there's an increase in mortality. That could be the reason why you see increased mortality rates, differential mortality rates for Black African Americans. So think about it. If you live in a community with a lot of pollution sources, you've been exposed to these toxicants, as Hilton mentioned, your lungs are damaged. You have limited capacity. And then you get a COVID-19 infection, your mortality rate is increased. That Harvard study used county level PM 2.5 data. It didn't talk about PM10. It didn't talk about PM1. It didn't talk about ultrafine particles. It didn't talk about hazardous air pollutants, some that Hilton mentioned. It didn't talk about benzene. It didn't talk about formaldehyde. It didn't talk about PAHs. So really, I think what we're probably seeing is it's more significant than what was found in that study, because in this country right now, to be frank, we do not have the regulatory monitoring system to capture daily exposures. So we don't know in the community that Hilton described what people are actually been exposed to. As Hilton said, the cumulative impacts of exposure. We don't know what's going on in places that are dealing with goods movement issues like Hilton's community, whether it be Houston, whether it be New Orleans, whether it be San Diego, whether it be Newark, whether it be Charleston, South Carolina, whether it be Savannah. We do not know because we are not monitoring for all the chemicals that folks have been exposed to. So what COVID-19 has basically done is made people who we made invisible, visible. A lot of folks in our country who are dealing with disproportionate impacts from hazards, whether it be pipelines, whether it be industrial animal operations, whether it be petrochemical facilities, whether it be highways, they've been made invisible. We dump on them, we forget about them. COVID-19 has made them visible.
Yeah.
And so what's important, what Hilton talked about when you bring in climate change, those same communities, because of comorbid conditions, they are more vulnerable to impacts from climate change, whether it be heat waves. I mean, think about this year. This year is the 25th anniversary of Chicago heat wave. Have we learned the lessons from the Chicago heat wave? A few years ago, we had multiple deaths in Baltimore from a heat wave, and also in D.C. I don't think we learned a lesson. This is also the 10th anniversary of the Deepwater Horizon spill, the leak in the Gulf Coast. Have we learned those lessons? Listen what Hilton just said. No, we have not. This is also the 15th anniversary of Hurricane Katrina. Have we learned those lessons as relates to flooding risk for folks who live in the Gulf Coast, folks that live in other parts of the country, sea level rise, who may be in waterfront communities? I don't think we have. You can look at Hurricane Maria, you can look at Hurricane Sandy, you can look at Hurricane Florence, you can look at Hurricane Harvey. We did not learn the lessons from Hurricane Katrina. So you have flooding issues, you have heat issues, you have issues of respiratory conditions, as Hilton did a great job of explaining. We have not learned those lessons from these disasters. And so when you think about climate change is going to impact us all, but it's going to impact many of us differentially, right? And what COVID-19 has shown us, whether it be a natural disaster, right, a technological disaster, or a biological disaster, some of us will be impacted more than others. So the point is, as Hilton mentioned, we haven't been focused enough on investing and addressing issues that impact many in our communities who we made vulnerable. They're not vulnerable because of who they are, because of how they were born. They're vulnerable because of social issues, economic issues, hazard issues, geographic issues. I'll let Brother Mustafa talk now.
Well, that was great. Actually, that's a perfect segue into what I'm going to ask Mustafa. And Mustafa, you always say this, and I know it resonates with a lot of people. It resonates with me, that we should be moving communities from surviving to thriving. And I like to, just not only based on what we've heard just now, which is, a great example of what people are dealing with every day. It's just, the top of the iceberg, I'm sure. But can you, incorporating that information and what you know from your own work with communities, can you talk about what that really means, and add in, how that relates to what we need to do to adapt, to do better, to be better?
Sure. Oh, definitely. And thank you all for having me. We just have to move to a 21st century paradigm. What Hilton and Dr. Wilson had shared with us was, our reliance on fossil fuels. Let's just anchor it in the facts. We have 100 to 200,000 people are dying prematurely every year from air pollution. And that air pollution is the things that Hilton and Sacoby just shared with you. So if we're not willing to sort of stop the old behavior that has gotten us to the positioning that we're in the sense of having these chronic medical conditions, then, nothing is going to change. This is not the only pandemic. This is not the only emergency that we're going to have to face. So for us to move people from surviving to thriving means we have to change what's going on. Folks that also share with you around asthma. We got 24 million people who have asthma in our country, 7 million kids, and primarily as African-American and Latinx folks are the ones who are going to the emergency rooms and the ones who are losing their lives. And all of that is tied back to what Dr. Wilson said, PM 2.5, PM 10, PM 1. So we've got to change the dynamic that is going on. We also have to, for those of us who work on climate change and environmental issues, we have to think more holistically. So that means that we have to also address the medically underserved areas. We got 20 million people are living in physician deserts. And if we know that those are primarily located in the locations that the previous speaker shared with you, then we have to build the infrastructure to make sure that these public health issues can be addressed. We've got to make sure that we are training our physicians to understand environmental impacts. We've also got to make sure that they're in the locations so that we can continually monitor people's health and have them to be able to access the health care that's needed. We live in a country right now where we've got 80 million people who are uninsured and underinsured. So if we've got folks who are living in these communities that are being disproportionately impacted, but they don't have access to having health care insurance, and then they can't even get to a facility or get to a doctor, then we've got to change that dynamic. And folks have been talking to us about the things that we need to do to actually make that happen. And how do we do that? So, for years, people told us that the resources were not available to be able to address the social safety net in a significant way. We've now seen that that is a false narrative. We've moved between $3 to $5 trillion in just about a 6-week time frame. So that means that it is an issue of prioritization and not an issue of the resources being available to make the change happen that's necessary. If we don't do this, and Sacoby set it up perfectly, and we can actually make this change that's necessary. Everybody remembers Katrina. Don't just remember Katrina, remember the Superdome. Remember the Superdome and the 10,000 people who were packed into that location. We are a month away from moving into hurricane season. How do you social distance? How do you quarantine if you're faced with that situation in multiple locations? So what I'm saying is to move people from surviving to thriving means that you have to think critically about where we're going to place the resources and how we're going to get ahead of the curve. You hear everybody talking about getting ahead of the curve. We have to make sure that these new stimulus packages are actually addressing the needs that exist now and that will help us to build a foundation for the future. So, and we can't let up because folks helped to bail out the industries and businesses because they said it was tied to jobs, and they gave everyday people, just a little teeny tiny sprinkling of what they needed. We have to make sure that the future stimulus bills actually meet those needs, and we have to make sure that these other pieces of legislation actually are going to fulfill the promise that people have been sharing with communities for the last 40 years.
Okay, great. Very well said. And a perfect lead in to my next question. As we all know, maybe about a month ago, a little over a month ago, EPA decided to lift regulatory oversight for polluting facilities. So started giving them a license to pollute. And where they were, there were already incidences where there were releases and people didn't know about them, or there were a number of exceedances in general. And now they're told that if you do this and you say it's because of COVID-19, that we're not going to fine you. So I sort of wanted to get your insight, because we haven't discussed this, Mustafa. Like, what was your initial reaction when you heard about that, particularly given what you just talked about when it comes to regulations and legislation?
Well, to be quite honest with you, I thought that it stated very clearly that this administration does not care about the lives of African Americans, does not care about the lives of Latinx communities, does not care about Asian Pacific Islander communities or indigenous communities, or even low-income, white communities. Because what it did was saying that we know the history is there, that business and industry, some operate in an ethical fashion, but there are a number who do not. So how are you not going to utilize the fullness of the enforcement capabilities of EPA and allow folks to sort of self-monitor, to self-regulate? We know what the outcome of that is going to be. And we have to also tie that to the fact that communities have never had the level of enforcement that they have asked for. So if we knew that we were operating from really a bare minimum level, to then take that away just sends a very clear message to those communities. And I think that, there is some legal culpability in the additional lives that are going to be lost. And I hope that those who are, much more astute with the law will begin to look at it more clearly. And I'll say the reason I say that is because we have an example in Flint, Michigan, when folks intentionally did an action, and that action resulted in people losing their lives. And then those who are part of that process were called up on manslaughter charges and other charges. So there was a direct connection there, and people began to explore. And I think that if there was, a stronger set of environmental laws that focused on the criminality that sometimes exists, along with some of the other aspects, it would change behavior. If people knew that they were not going to get just a slap on the hand, but they could actually spend real time behind bars. Let me preface that by also saying that, again, there are those who follow the law and do the right things. But when you tell people you're no longer going to enforce, you're no longer going to monitor in a serious way, then you're going to get bad behavior.
Thank you for that. I totally agree. Sacoby, what was your first reaction when you read about it? Or
I wasn't surprised, but I wasn't surprised. I think the problem Mustafa said, I think it speaks to the fact that many of our communities are already sacrifice zones. So let's just accelerate the process. To me, it shows that they don't really value human life, right? Don't really value human life. And so, I think part of the issue, and kind of ripping off of what Mustafa said, I think part of the problem that create these conditions, the regulations haven't been protected the most vulnerable, most susceptible populations in this country. That's why, think about it. Clean Air Act, Clean Water Act, you think about the 5th anniversary of so many things, a NEPA. If you really enforce these laws, we wouldn't have environmental injustice, right? If we really enforce these laws, we wouldn't have environmental injustice. So I think that's one issue. Another issue is, which is very egregious, thinking about the EPA, we permit polluters. We're managing pollution, but you don't have a monitoring system that reflects the industrial footprint. So your monitoring footprint doesn't reflect your industrial footprint. So we have no idea in many cases where people have been impacted pre-decision, pre-COVID-19, right? You have the self-reported, Mustafa said, through toxic inventory. There's thousands of chemicals people have been exposed to. Barely any are monitored. And even less monitoring happens in communities of color. So this situation is set up because of poor monitoring in advance of COVID-19. So right now, what this forces, it shows us, we have to do our own monitoring. But at this time, EPA won't use citizens collected data for enforcement. Well, right now, if you can't count on your government, you got to count on yourself. So we need to actually have more monitoring that's actually community-driven, community-based.
Right.
And you think about climate change, how do they intersect? Well, these communities that we basically been sacrifice zones, and now we're creating more sacrifice zones. You're gonna have more greenhouse gas emissions. You're gonna have more coast pollutants, right? So Mustafa gave you the numbers. So those asthma numbers are going to increase. Hilton gave you numbers. Heart disease numbers are going to increase. Infant mortality numbers are going to increase. Mutated DNA is going to increase. Reproductive impacts are going to increase. Oh, neurological effects are going to increase because of this decision. And then also, when you have industries with less control, think about some of these issues around accidents, as Hilton already explained. Deepwater Horizon, could be another, could happen again. Think about issues I talked about earlier. When you look at pollutants that can cause cumulative impacts, I think we really have to think long and hard about how we're going to recover from this decision. And also, when you think about COVID-19, how could you make that decision when you're actually increasing the susceptibility of populations who we've already have to do more for when it comes to health access, and we need to be thinking about them more right now. So I'll stop there.
Right, great, thank you. Hilton, I'd like to, could you just give us your first impression, your initial impression when you found out about this new EPA decision?
Well, when I found out about the EPA decision or the Trump administration decision, really, I was so angry to where I immediately got on the phone and called many of my friends in the environmental justice movement and basically articulated to them, we have to do something about this. I'm living on the front line. I live on the fence line. I'm watching these babies take their nebulizers to school. Even both of my grandkids here, one is 18, his little sister is 8 years old. She started showing respiratory problems at 3. He's been suffering with breathing problems since he was 6 months old. Now he's 18 and he still suffers with allergies. He's been taking breathing treatments ever since he was 6 months. And now he's 18 and he still have difficulties. There is a huge, huge problem here and a huge disparity that needs to be addressed. But what do we get from our administration? Relaxing of the Clean Air Act laws, the few laws that are in place to help protect human health and our environment. Not only that, they're trying to even take away our voice to speak up when we have an environmental issue when it comes to these guys getting their permits. They're trying to make it more difficult for the people that are being subjected to thousands of tons of benzene, thousands of tons of 1,3-butadiene, which both of these chemicals are known carcinogens. Thousands of tons of sulfur dioxide, ammonia, and various other toxic chemicals, particulate matter. And now we can't even speak about it. And I went up to the Hill and I spoke about 2 months ago there on Capitol Hill at the NEPA meeting, the National Environmental Policy Act hearing. And I spoke on that very issue on how this administration seems to be trying to silence us. And when I look at who's in charge of the Environmental Protection Agency, Wheeler, well, it's the fox guarding the hen house. Wheeler was a lobbyist for the coal industry. So how can we win? How can we get a break from this when we don't really have a friend in the present administration? So it's going to take people like ourselves stepping up to the plate, fighting for our young people's right to breathe clean air, fighting for our young people right to drink clean water, fighting for our right to live in an uncontaminated environment. It's a God-given right for every man and woman to have clean air to breathe. It's a God-given right to have clean water to drink. I mean, this administration, in my opinion, is negligent. This administration, in my opinion, their actions are criminal because they have the numbers. They know the amount of toxins that are going into the air that we're breathing. We have the death rate, the mortality rate here is that we have the 10th highest mortality rate from cancer and respiratory problems than all of Texas, right here in Port Arthur, Texas. We are dying. And this administration is driving another nail in the coffin of our kids.
Okay. Thank you, Hilton. Thank you very much. So we'll go on to the next question. I appreciate you guys giving me that input. So when we talk about the inequalities that you guys have, all three of you have very, laid out very well, how do we ensure that we're preparing for climate change in the face of this deregulation order? Like, what is it that, and I know we've all given this some thought. So could you just share with us, what is it that we can do to address the inequalities that are automatically going to occur from this pollution license, or license to pollute, rather? And with Hilton.
Yes, well, what I'm seeing here on the fence line in my community and in Houston, Texas, and other communities where you have large polluting industries is it's time for residents of those communities to take charge. It's time for people to come together and discuss ways in which they can help themselves. Do not stand by and just be a victim. Yes, we must speak truth to power, but while we're speaking truth to power, while we're protesting in the streets, we have to come together and learn to devise a plan. Of course, we have to do things within the law, but yet we have to get our local governments involved as well. Our local governments live in these communities as well, but yet many times they turn a deaf ear to your cry until it knocks on their doorsteps. But I know a previous mayor here in the city of Port Arthur, well, he have a relative. I mean, a relative of his mom is suffering with cancer. So if that's not hitting home, I don't know what is. So we have to learn to point out the ills that are impacting the family members in the communities, how it's impacting the persons you're talking to, and help them to understand we must unite. We have to come together to fight for our rights. And at the same time, come up with some sound solutions. There are solutions on the table within community organizations that need to be brought forward, because if we can't get help from our federal government, we have to devise a way to protect ourselves and look at ways in which we can get the technology to protect and defend ourselves and gather the data we need to force our administration and local governments, state governments to help, because it's their job. That's why they're in office.
Thank you, Hilton. And in a moment, I am going to ask you to share with us one of those adaptation measures that that we can implement with no problem. But before that, I would like to actually invite Sacoby to give us his ideas about ensuring the inequalities are considered as we prepare for climate change, which I think you pointed out is coming up on us very soon.
Yeah, I think when you look at the executive rollbacks, one of the things, and Mustafa alluded to this, I think a focus on resilience is important. One thing I like to talk about is how can we invest in communities? So looking at various sets of resources that allow us to do better planning, better community development. I think a lot of the issues that the different provincial impacts, what communities we're talking about, we could address them by investing in green infrastructure, for example. Thinking about issues around stormwater management. How do we, as Mustafa said, help people get access to health insurance and health care? I think that's an important issue. So those investments. So we talk about the climate change as an issue. How can we think about climate change as an opportunity? Many cases when we talk about climate, we don't really talk about it from a pocketbook perspective. So how we can talk about it from a pocket perspective, make it more proximal. So food, faith, family, health, and jobs, right? So how do you invest in those things? How do you invest, as Hilton said, in community and people? How do we, connect the people through that faith? How do we think about jobs, creating new microeconomies that allow us, when we talk about adaptation, that we're creating microeconomies? Health is not just diseases, right? But how we create a sustainable community ecosystem. And when you think about adaptation, particularly when we think about rollbacks, where's the equity lens, right? I mean, this is sort of a different issue, but one of the things I like to talk about a little bit is how when we talk about climate change preparedness, we never talk about equity. So preparedness, response, and recovery. So equity, including funding, where to go, how we focus on our most vulnerable populations. Hilton talked about family members, children who have asthma. How do we talk about elderly folks who we know from Maria, from Katrina, from Florence, the sick, the shut-in? We need to focus on them when it comes to climate change adaptation. Going back to the Chicago heat wave and more recent heat waves, who are the people who were differentially impacted by the heat wave? So you have differential morbidity rates, right? Elderly folks. So there are things that we can do by really having an equity lens and really focusing on those who are most vulnerable and those who are most susceptible. But our investments have to be there. Whether it be at the local level, state level, federal level, we need to have those investments, and we need to have an accountability where those dollars go. Mustafa mentioned stimulus bills. I'm going to let Mustafa talk. Look at the stimulus bill. Hey, you need a loan, right? Hey, Lakers, you get a loan. Hey, you hotel, you don't need it, but you get it too, right? Just from that stimulus bill, folks are getting money with supposedly small businesses. But, we didn't need an accountability czar, right? That in itself is a problem with waste. So you got to make sure there's accountability with any stimulus package. We already seen this administration, they don't care about accountability. So we got to make sure those dollars go to, as Hilton and Mustafa already said, go to places that need it the most, and make sure we have the right formulas to make sure those communities who need it the most are getting the money that they need through an equity lens. Go ahead, Mustafa.
Right. Yes, thank you. And Mustafa, I'm going to ask you the same question. These are you guys, these ideas, your opinions are very important, and I hope that there are people in the audience who are taking note of what you're saying so that we can implement some of these wonderful actions. So Mustafa, please share with us.
Yeah, I'll be real brief because I think Hilton and Sacoby hit many of the major points that we should be focused on. But I'll just share this with folks. For the first time in my career, in the time that I've been doing this work, and it's over a couple of decades now, people are actually finally beginning to pay attention to the air. So what are you going to do with this opportunity to actually help people to have a much better understanding about why and how air quality matters, right? Because people understand, that the virus is passed through the air, and they're beginning to pay attention also because there's a lot of folks who are now talking about the impacts, that are coming from pollution and how it's making people's immune systems weaker, so forth and so on. So we've got an opportunity to actually anchor people in the reality that they weren't paying attention to before. What do we do with that education? Well, some of the things that we need to do is to tie that to our vote. So we often have these conversations around climate change and environmental issues, and we don't talk about our vote. Our vote is critical in this process on the local, the county, the state, and the federal level to make sure that, one, we are actually identifying individuals who should be running for office, right? And that we are educating them so that they have a buffer around them and that they don't get swayed once they come into office because they feel like, well, folks just showed up, in the beginning when I was running for office, they cast their vote and then they no longer, were engaged in the process. The other part of that is for us, if we're serious about climate change and addressing environmental injustices, is to begin to identify the folks who need to be in the various leadership positions in the Environmental Protection Agency, but also in those other 16 agencies and departments that have a responsibility for environmental justice, and I would say also a responsibility for helping us to win on climate change. And if we're not willing to do that, we're going to leave gaps in the process that will make it much more difficult for us to get to these other items that we've been talking about. You can't move resources if you don't vote. You can't address the capacity needs if you don't vote. And you can't actually help to influence what policy looks like if you don't vote.
Thank you. Gosh, you guys are fantastic. I did have one before we I guess open up for questions. I really wanted to sort of have Sacoby tell us a little bit quickly about, gosh, when you said this to me in our interview, it really resonated with me, and it has since resonated with people who've seen that our interview. And you sort of touched on this, and I think Mustafa did too, about we keep failing over and over again to protect the most vulnerable. And this sort of goes with the next question, I think, about sharing one adaptation measure that can be taken to address climate change, COVID-19, and EJ communities. So we haven't learned, we've been failing. What is it that can be done in the adaptation framework so that we don't keep failing? So what is the first thing that, I guess, I mean, there are a lot of things that can be done, but for you, what is the most pressing thing that we can address, or the most pressing action that we can take? I'm sorry.
I mean, I think we have to address social determinants of health. We have to address poverty. By addressing poverty, we invest in infrastructure. We have to invest in people. We have to invest in communities. That, to me, is the most important thing we can do.
Okay, thank you. And would Mustafa or Hilton, would you like to add to that, or anything extra before we move to questions?
Yeah, I mean, yeah, this is Hilton Kelley. Sure, I can add to that most definitely. I believe that one of the most pressing things we need to address is giving people the resources they need to protect themselves, giving people the stability they need to stand up to hurricane after hurricane. And that means prepare before the storm. Don't wait until the storm is upon us to prepare. Give us the resources and the access that we need to resources to prepare today, not tomorrow.
Yep, thank you. Mustafa, anything? Okay.
And I agree with both what Sacoby and Hilton said. The only other thing that you need to do is you need to make sure that there is an environmental justice or environmental equity analysis for all the program policies and activities that your organizations are utilizing, and to make sure that on the federal level and the state level that analysis exists. If you have that in place, it will help to, address many of these ills that we continually see. And I'm not just talking about having that analysis when we're talking about environmental issues. I'm talking about housing and transportation on the public health side and on the job creation side.
Exactly. Gosh, these are great. Why don't we take a couple of questions, and I think I'll let you guys decide who wants to answer them, because I don't want to assign them to you. This is a question from Jackie Cole. She said, how do we organize around policy that's being developed to address environmental justice issues? And she goes on, for example, in California, they had SB 100, which is a policy that requires cities and counties to develop environmental justice component with housing, Mustafa, just like you just said, housing, food access, civil engagement, prioritization, in their general plans. But none of the agencies have relationships in the community. So how can you build and organize communities that have historically been absent from these discussions? Wow, this is a question that I think each of you can contribute to.
Well, I can go first if you like.
Sure, please.
My fight started 20 years ago or 21 years ago here in the city of Port Arthur. And initially, our state regulatory agencies looked at me like I was a Martian when I walked into their office, because they had never really had a community person come in and ask to see paperwork on some of our big polluters. So it starts with the leader. It starts with the people in the community. You have to learn who the players are. Who is your regulatory agency? Who's running it? Who do you speak with? So every state has a a environmental justice agency or an environmental agency. Here in Texas, it's called the Texas Commission on Environmental Quality. Some other places called Environmental Quality Department or agency. And then contacting your environmental protection agency is always a good start as well, and getting the information you need on who to talk to.
Yes, thank you, Hilton. So, Sacoby?
Yeah, that's a great question. I think California provides great examples of what can happen, but you got to have that community organizing infrastructure in place first. I would say in Maryland, we don't have as many groups that I would classify as environmental justice groups in our state. And so we don't have the capacity. And I've been here since 2011. Not that many EJ groups are driving this connection between climate justice and environmental justice in this state. You got United Workers in Baltimore who's doing some work around fair development. They're having an impact. You have a few other groups, but beyond that, we don't have that organizing infrastructure. And I think that's one problem. Heck, in my county, we don't even recognize we have EJ issues. I was told at a hearing, Crises County it doesn't have EJ issues because it's primarily black. So the county leadership denies that they can even have EJ issues because their political leadership is black. So one thing we got to do is we got to understand no politician goes to politician school. Regardless if you're black or white, you need to understand what EJ issues are. You got to understand Title VI. And you got to understand your responsibilities to address those issues, right? And then we have a state agency, MDE, who helps to run our state commission on environmental justice. That commission's been a do-nothing commission since I've been in this state. So we have we so-called progressive in the state, but this state's progressive in talk and regressive in action. And so we need to have more groups who get funded to push these politicians in these agencies to do more than just talk and do more action.
Thank you, Sacoby. And Mustafa, I'd invite your comments.
Well, one of the things that will be helpful, or one of the things that's going to be critical moving forward, is to make sure that you have senior advisors in each of the 17 federal agencies and departments. But we also have to make sure that we've got folks with frontline experience who are becoming our mayors, who are becoming the governors, who are holding these high-ranking positions in the various agencies and on the state level. So in all the time that I've been doing this work, very rarely, extremely rarely, probably less than 0.1% of the time, have you ever run into someone who comes from our communities and done work in our communities that has that high-ranking leadership position to help to make sure that things are moving in the right direction.
Right. Thank you, guys. So we have one final question before we wrap, and I'm so excited that from just the energy that the three of you have generated, and I just want to, before we end, let you know how much that's appreciated. So this is from Helen Waller. She says, what do you all think are the key resources for communities to respond to acute disasters? And I think each of you have kind of touched on that, but let's just hone in on some specifics, a couple of specifics that people can sort of note to generate action. And we'll start with you, Hilton.
Yes, well, when it comes to an environmental disaster or some type of incident that take place, I mean, one of the key things you have to be prepared to do is to take notes, is to get an understanding as to what happened, and also try to identify what laws and regulations that govern that particular industry that you're potentially dealing with. You have to know the laws that govern your refineries or your wastewater treatment facilities, and then you have to understand who to contact. So getting your information together and being prepared to address it is paramount to launching an environmental justice fight.
Okay, thank you. Mustafa.
Well, if I understood the question properly, for me, it would be making sure that the infrastructure is in place. So if we're going to talk about adaptation, so in each disaster or emergency is different. You can have a heat emergency and you need a different set of resources to address that, which is different than a flood or a hurricane. So you got to have the transportation in place to help people to be able to move away and then to be able to return. You've got to have the infrastructure in place around housing. You've got to have the infrastructure ahead of time that builds the capacity on the technology side so that people can communicate with each other, so that communities can communicate, so that frontline workers and emergency personnel can communicate effectively to help, whether it's communities or others, to be able to move and to know where to go, and all the various things that go into that space. So that's why I say it's a little bit different. But if you start with making sure that the infrastructure, which communities have helped to design, is in place, then I think it gets you moving in the right direction.
Okay, thank you. And Sacoby.
Yeah, just to build off of that, part of what you need to know is, do you have a disaster sort of response plan? Well, at the local area, just like you have a local response team, who are the assets that can be activated, right? When you have disaster, as Mustafa just mentioned, do you have a climate action plan? What are the components of the climate action plan? Who are the folks that you communicate with to help implement the climate action plan? So you gotta think about, as I said earlier, when you have your disaster preparedness response plan, you gotta know who your most vulnerable are. Where do they live? What are the demographics, right? So that's part of your asset mapping. It needs that has to happen in the community to inform your disaster plan, your disaster response plan. That has to be built up. In Baltimore, they have something called resilience hubs. I like the concept. There's a flood event or a heat wave, you have places to go for cooling, you have water, you have backup power. But as Mustafa mentioned, resilience hubs are a good construct, but you have pre-existing conditions before this disaster. So what does that mean to do a resilience hub in a place, like Hilton mentioned, that's already overburdened by hazards? That resilience hub is going to be different than a place that may be wealthier or has more resources or has less hazards in close proximity to those populations of concern. So I think the resilience hub concept is good, but again, you got to have the infrastructure to make it work, and you have to have a plan, and it has to be a community-driven plan.
Okay.
It has to be a community-driven plan for it to be effective.
Yeah, thank you. Thank you guys so much. And I think the takeaway here is that I've gotten is that, one, you've got to identify the people that need to be at the table and the people who are going to be important when it comes to addressing any particular types of response when it comes to disaster. You're going to have to invest in communities and invest in the proper activities that are geared to protect communities. You're going to have to focus on infrastructure, which is important in protecting communities and in addressing public health in general. And you're going to have to, as a people, be informed about your local and state and federal officials or whoever is running for office, and informed about whether they're speaking to the needs of the community. And if I got any of that wrong, please correct me. Okay, so at this time, it's 4:59. I'm going to turn it over to Molly, and I want to take the opportunity to thank you all for participating in this webinar and thank our attendees. Molly.
Yeah, thank you all, and thanks, Adrienne, for leading that discussion. Thanks to everyone for joining us. I just want to point everyone to the resource handout that's should be in your control panel, and there's a lot of extra resources you can read up on the issues talked about today and actions to take beyond just this webinar. And I really appreciate that was the focus, that we can leave here today and actually do something about what's going on. So thank you all for your wisdom with that. And in connection to that, if you are leaving here today with a project in mind that you want to implement regarding adaptation, climate change in your community, you can share that with us at www.globaladaptationmonth.org and put your project on the map. It's a way of inspiring others to do the same and sharing about the fantastic work that everyone's doing in their communities to make a difference. So once again, I do want to say thank you. We have another webinar coming up in the end of May, focused on rural resilience and integrating climate change planning into hazard mitigation planning. So you can register at www.nationaladaptationforum.org. And at this point, I just want to give it a chance for our panelists to say one last thing to close us out.
You want to start with Hilton, or Sacoby raised his hand?
I just said bye-bye. Thank you.
Yes, thank
Well,
you.
I'd just like to say I really appreciate everybody coming together. And once again, when I heard the news how Trump was rolling back all these laws and regulations, it really hit home with me. We must do all that we can to help protect our communities, our air, our water, our land. It's all we got.
That's right.
Mustafa?
Let's stay focused on moving our most vulnerable communities from surviving to thriving. And one of the ways that we do it is by making sure that we vote.
Thank you.
Well, thanks, everyone. Have a good rest of the afternoon. And yeah, hang in there, stay safe, and stay healthy. Thank you.
Yeah. Thank you. Thank you, Mike.
Take care, everybody.
Bye-bye.